This segment of CoastLife is sponsored by Beebe Healthcare.
Well, CoastLife, we've been talking how excited we are for fall. The official start of spooky season is here, but it's also the start of flu season and respiratory illness season, which that's the not so fun part of this time of year.
Not fun at all.
No. But lucky for you, Angie Scott with Beebe Healthcare, the community health coordinator, is with us today, talking about how Beebe Healthcare is keeping you guys safe. So Angie, you guys got a lot going on to help keep people healthy this time of year.
Absolutely, absolutely. We really take a deep dive into this time of year. It's a super busy time of year. This is the time of year where we do our free community flu clinics. And this particular year, we've got over 20 free health clinic or free flu clinics scheduled. So yes, it's quite a few, and it's all over Sussex County.
Yes,
so.
Free and all over Sussex County. Yes. I know have grabbed the ears of a lot of people. How are you encouraging folks to get out there and get those vaccines? Absolutely.
So our free flu clinics are for those 18 and older. We do encourage everyone to at least have a conversation with your primary care provider to make sure that it's appropriate. Make sure that you're getting the right flu vaccine. You can actually schedule the flu vaccine with your primary care, but we also realize that there are a few folks that can't make it to the primary care provider.
Sure.
Or it's just more convenient. You're working and it's just right across the street and you pop over and you can get it done. So we do have our free flu clinic flyer posted on our website and through social media. So.
Yeah, awesome. And why is it so important, if you don't mind jumping into that a little bit more, for certain people to talk to their primary care before they may get a flu shot?
Because there are different types of flu shots. For those, flu shots are recommended for anybody 6 months and older. But for those that may be under the age of 8 or have certain high-risk conditions, maybe over 65, on chemotherapy for cancer treatment, those are all conversations that a primary care provider would really honestly know the most intimate detail about that patient and determine which flu vaccine is right for them.
Good, that makes sense.
Is that how it works too with RSV?
Correct. Okay. So RSV did have some changes this year in recommendations from the CDC. So having those conversations with your primary care provider about when and how and if it can be combined and that sort of thing would be best.
Yeah, for sure. Yeah. I know this time of year, there always seems like there's some myths surrounding the flu shot. What are some of those myths and how do we kind of dispel those?
Yeah, so some of the myths, the biggest one we always get is, oh, I got the flu shot and it gave me the flu. Yeah, so the flu shot actually cannot give you the flu if you're getting one of the standard like injectable doses. Now there is a live, I'm going to use a big word here for a second, live attenuated virus that is done in the flu mist. And that's only given, that's one of those that gives in the primary care office. We don't do that in our free clinics.
Right.
But the flu shots themselves are actually, what they do is they act like antagonists or kind of provokers of your immune system, so that it's not actually giving you the flu virus, it's giving you little bits and pieces so that your body reacts and produces those antibodies.
Right, so it makes you feel sick for a little bit, but it's so that you can better fight the flu so you don't get seriously sick. Because if you've had the flu, been down and out, the worst.
It is really rough.
Yeah.
What are we seeing RSV-wise as well? Because I know that the symptoms are different in adults, so what are we seeing with kids this time of year?
So our kids in RSV are, we're seeing, of course, it's back to school season, and so we're seeing a little bit of a pickup in respiratory viruses related to that, and that's flu, that's RSV, that's even like we're seeing some, it's not a virus, but the whooping cough kind of a thing, allergies, all those sorts of things. So again, best thing to do is just if your kid is staying sick for more than just a few days, if you got a fever that's super high and you can't get it down with the standard, Tylenol and ibuprofen, to get them to their pediatrician.
Okay,
makes sense.
Yeah, definitely good to know. I didn't even think about schools coming back. I mean, we used to call it the college flu or something, but I know it's not just in college. It's in all schools, maybe even workplaces.
Daycares even.
Daycares are a big one.
Yeah,
okay, good to know. So just get in touch with your primary care, I think, is the bottom line. But those flu clinics that you have, those free ones, are good to know about.
Absolutely.
Exactly. Can we run those details again, how long they're running for and what people need to do to show up or make an appointment?
Yeah, absolutely. So our free flu clinics are starting this Saturday, October 5th, and running all the way through to our Frankfurt Health Fair, which is going to be November 23rd. There's going to be a little over 20 of those, and we typically, over the course, at least last year, we gave a little over 3,000 free flu vaccines to the community. So, yeah, look on the website, check social media to see which ones work best for your schedule.
Perfect.
Right, a good reminder.
Well, Angie, thank you so much for coming in and help spread the word to not spread the germs and keep people safe this flu season, and make sure you're all taken care of and set to go so you can enjoy the upcoming holidays that'll be around before you know it. But we've got some more CoastLife to get to when we get back. We're keeping the theme of staying healthy. That's on the way.